So welcome to a quick tutorial of how to read a non-enhanced CT scan of the thorax. In this video I'll show you my approach to native CT thorax and some tips that I have adapted in my practice and I found very useful. I usually begin with a lung window, and as with any CT scan that I read, I take a quick scroll throughout the case to get a quick overview. If I see any obvious pathology in the beginning, I usually spend my first few minutes to look at that and try to figure out what's going on. But if I don't see any pathology, I change over to a 10mm MIP slices to enhance my search through the lung parenchyma. This is because the MIP really makes it easier to find small noduli and other consolidations. So first I divide each lung into 3 specific search areas so I can focus my eyes on a specific area as I scroll throughout the case. So for example, we could focus on the ventral third on the left side as we scroll up and down, without seeing any noteworthy finding here. I then repeat the process for each search area, and I might also repeat this process in different planes, such as the coronal or sagittal. Once I look through the MIP slices, I switch over to the opposite or the mean MIP. I find this quite helpful when looking at the airways, especially for minor bronchiectasis or air trapping. Once I finish looking throughout the lung parenchyma, I change over to the soft tissue window and I look for pleural effusion. I also look for any pleural thickening or a pleural plaque. Next, I look at the pericardium, which should be a thin stripe, unlike cases for a pleural effusion. I then look for enlarged lymph nodes in the lung hilum bilaterally and the mediastinum. Note that the pericardial recess can mimic a lymph node. I then look at lymph nodes in the axillary area bilaterally. These tend to be slightly larger, but having a look at the morphology is also quite helpful, such as the fatty hilum, which is a benign feature. If possible, I try to look at the supraclavicular lymph nodes, but these can be really hard to see. Normal musculature and vessels can be confused for lymph nodes in this area. I then look at the vasculature. So despite being a native CT, we can still estimate the size of the ascending aorta, descending aorta, and the truncus pulmonalis. The coronal plane is also quite helpful to look at the branches of the arcus aorta. Finally, I look at the bones. The sagittal plane is often the best to estimate the thoracic vertebrae, but the ribs can be tricky. However, using the MPR lines parallel with the rib, you can basically appreciate the whole rib quickly in one glance. And then lastly, I go back to the soft tissue and then I have a quick look around the soft tissue in the periphery, as this can be an easily missed place. I then scroll further down and I look at the upper abdomen for any abnormalities.